everyone, it's Nurse Hoffman from Lamar Elementary. I wanted to make a quick video to share some resources with you. These resources are going to be reliable, factual, and they're going to be something that you can trust. I know it's really hard right now. Social media has a lot of information, but not all of it is true, and it's hard to separate fact from rumor. So I wanted to share the resources that I myself am using, and I know that others in the district are using as well. So I'm going to put this on screen sharing so you can watch me Google. You can see what parts of the websites I'm clicking on, so you will be able to do this as well in the future. So give me 1 second to just put that on screen share. Okay. Okay, you should be able to see my screen now. So I'm going to go to Google. The first resource that I want to share with you is going to be the World Health Organization. This is going to share information about COVID-19 or the coronavirus from a global and international scale. So we're going to click on this link right here, which is the World Health Organization. Then we're going to click on their coronavirus disease information. We're going to link. We're going to click Find Out More. The reason I really like this site is that it has a very easy to read FAQ. So we're going to go there first. We're going to go to Your Questions Answered. So what is the coronavirus? The coronaviruses are a large family of viruses which may cause illness in animals or humans. The coronaviruses, the family of coronaviruses we have been exposed to before. They're often the cause of the common cold. COVID-19, however, is an infectious disease caused by the most recently discovered coronavirus. So this is a new coronavirus. It is genetically different from coronaviruses before. So the symptoms of COVID-19, it's going to be fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throats, or diarrhea. Symptoms are usually mild and begin gradually. Some people are infected and don't have any symptoms. About 80% recover from the disease without needing any special treatment. 1 in 6 will develop difficulty breathing and need more treatment. Those who are going to be most at risk are going to be our older population, those with underlying medical problems like high blood pressure, heart problems, or diabetes. I think that another important part on this FAQ, it's full of really great information, but another part that I wanted to share with you, it says, should I worry about COVID-19? So COVID-19, the infection is generally mild, especially for children and young adults. That's good news. But it can cause serious illness, and about 1 in every 5 people who catch it need hospital care. This statistic is really important because that means 20% of those infected are going to need care at a hospital level. And that's why we're working so hard. We're channeling our concerns into actions to protect ourselves, our loved ones, and our communities. That's why we have the school closures. That's why we're preaching and we're practicing social distancing. And we're talking about quarantine. The goal is to lower our total rate and our total amount of those infected. That way, we're going to have a smaller percentage of those who need hospital care. We don't want to overload the hospitals. We want those who need care at a higher level, those who are at a higher acuity. We want them to be able to get that care. But there's limited room in the hospitals. So the goal is to lower the rate of infection. The goal is to lower the amount of those infected so the hospitals are not overrun. So again, there's a lot of more great information on this site, but I want to share some other resources with you. A great resource is actually our school site. So if you go to NBISD.org, New Braunfels District has their own COVID-19 resource site. And so you're going to click over here a little bit. Oh, it was already open. So let me show you how I did that. So we have, if you just click on this little scroll, banner scroll, there we go, until we get to the coronavirus. So you're going to click here, and this is New Braunfels coronavirus reporting page. Our last update was yesterday on March 18th, 2020. It talks about our first confirmed case of coronavirus in Comal County. but this is a great place to go to get links to other resources. So the next site that I want to take you to is the CDC, the Centers for Disease Control. That is going to be at a national level. So the first link I want to take you to is how to protect yourself. I liked this page because it has pictures. It's really simple information. I think this is something that you could share with your children as well. So knowing how it spreads, the best way to prevent illness is to avoid being exposed to the virus. It's thought to mainly be spread from person to person. And they're saying within about 6 feet. And the way that the virus is transmitted is through infected respiratory droplets when someone coughs or sneezes. Steps to protect yourself: wash your hands often. You're going to be washing for 20 seconds with soap and water. And you're going to want to wash your hands after coughing, after sneezing. If you go out into the public, as soon as you get home, please wash your hands. If you can't wash your hands with soap and water, a hand sanitizer will do, as long as it's 60% more or 60% or more of alcohol. Try to avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick, and try to put a distance between yourself and other people. Again, that's going to be that social distancing. Try to avoid non-essential visitation, non-essential travel, non-essential visits outside the house. If you are sick, please stay home. Make sure you cover your mouth and nose, use tissues, and wash your hands often. Face masks. I know this has been a hot topic. If you are sick, you can wear a face mask, especially when you're going to be around other people, or if you're going to the doctor's office to seek care from your provider. If you're not sick, you don't need a mask unless you are caring for someone who is sick and they're not able to wear a mask. Remember to clean and disinfect the surfaces in your home, especially if you have visitors, especially if you have other people touching them. So this is a great page. I'm going to click back because I wanted to show you some more information here. So if you scroll down, this is, again, just the CDC's coronavirus information page. If you scroll down, we have cases in the US. You can click that. This is just some numerical data. It's going to tell you we currently have 10,442 cases in the United States, with 150 deaths, unfortunately. If you scroll down a little bit more, it's going to tell you 290 of those cases were travel related. So those people contracted the disease while they were abroad. 310 were close contact, so they got it from people in their household or others. Unfortunately, the majority, they're still investigating. They're trying to find the source of that infection. If you go down a little further, I think this is a great infographic. At a quick glance, it kind of helps you to compare Texas's rate of infection compared to the rest of the United States. The East Coast seems to have, both coasts seem to have a higher rate than the central states at the moment. Okay, and then I'm going to go back to the NBISD page because I want to show you the next website that I wanted to share with you. So this is going to be the Texas Department of State Health Services. This is a little closer to home. Again, we're going to be on the coronavirus disease page. And we're going to go to Texas case counts. So I think this is important because it tells you how many cases we currently have in Texas. So currently we have 143 cases and 3 deaths. If you go down a little bit, there is a scroll bar of counties and how many are confirmed infected cases in their county. Unfortunately, Comal is not on here, and I'm not sure why. I don't know if we're actually if they count us as a smaller county. But I'm going to go back to the NBISD page and show you how to see what's going on in our county. So right here is the Comal County Office of Public Health. We're going to click on that, and that's going to tell you how many cases are currently in Comal County. And we just have one. It was travel related, so that's good. And the person has been self-quarantined since their arrival back in Texas. So I just really think it's important to have access to these facts, to have solid information. I know that it's easy to become scared and anxious and worried during this time, especially when you see conflicting information on social media, which probably isn't even it's not intentionally false. There's just a lot going on. So I wanted to share these resources so you can hopefully help yourself to what is true and what is known so far. There was one more thing that I wanted to show you on the CDC that I forgot to show you. So I'm back on the CDC page. If you go down, I wanted to share if you're sick, what to do. So what to do if you are sick. Obviously, stay at home. Please try not to expose anyone else. Call in to work. Try not to go to work. Try to not go to any gatherings, other families' houses. If you're concerned that your symptoms may be COVID-19 related, call your primary care doctor and see what they say. Wear a face mask if you decide to go to the doctor's office, and they may tell you that in advance. I like this. Some of this is the same as what we went over earlier, but I like this part here because it tells you what to do if your doctor doesn't test, and when you're safe to go back into the public, and what to do if you are tested. So if you're not tested, you can you can leave home after these three things have happened. You have had no fever for at least 72 hours. That's 3 full days of no fever without medication that's reducing your fever. And other symptoms have improved when your cough or shortness of breath have improved. And if 7 days have passed since your symptoms first appeared. If you're going to be tested to determine if you are still contagious, you can leave home after these things happen. You no longer have a fever and your symptoms have improved, and you've received 2 negative tests in a row 24 hours apart. And of course, if you're going through this process, your primary care doctor or the doctor that you're dealing with is going to help you with this. But I think that's important information. And then one more thing, if you're sick and you have any of these emergency warning signs, please seek immediate care. These are going to include difficulty breathing or shortness of breath, any pain in your chest, or pressure. If you're confused, if it's really hard to wake you, or, again, these all apply if someone else is sick as well. If they're difficult to arouse, to wake up, and if you see any bluish lips or face, those are going to be reasons to get immediate medical attention. Okay, so let me get back to. So I hope this was helpful. I just wanted to share the resources that I'm using that I know to be factual, to be true. And I wanted to see if they could help you as well. I think information is power. If you have any questions during this time, please feel free to reach out and ask. And if I don't know the answer, then we'll find it together, and I'll reach out to someone else who may have the answers. Just know that we all care about you, and we miss the kids and we miss our families. I know everyone at Lamar is eager to be back. So hopefully we will get through this as a community, and soon we can get back to where we want to be, which is at Lamar with the kids. All right. Thanks so much.